Did you know that nearly 3% of adult men in the United States, more than 3.5 million, live with bipolar disorder, and many don't even know it? Today, in Real Men, Real Minds, we will explore the signs of bipolar in men so that you can identify them in yourself or someone close to you. This could change lives. If you find this content helpful, subscribe to Real Men, Real Minds. Your support helps us create more videos about mental health for men. Bipolar disorder is a mental health condition that causes extreme mood swings, from manic episodes where you feel invincible and full of energy, to depressive episodes where everything seems dark and hopeless. These changes can last for days, weeks, or even months, affecting your daily life, work, and relationships. Have you ever felt like you're on an emotional roller coaster with ups and downs out of control? Stay, because this could be key. According to the National Institute of Mental Health, 2.9% of adult men in America experience bipolar disorder each year, and 4.4% will face it at some point in their lives. Globally, the World Health Organization estimates that 40 million people are living with this condition, affecting men and women almost equally, although the form in which it occurs can vary. That means that in a room with 100 men, at least 3 could be dealing with bipolar disorder. Surprising, isn't it? Let's talk about the specific signs in men. Men tend to experience bipolar symptoms earlier than women, often in adolescence or early adulthood, about 3 years before women. During manic episodes, they may show increased energy and activity, racing thoughts and rapid speech, decreased need for sleep, grandiose ideas or inflated self-esteem, impulsivity such as overspending or risky behaviors, and irritability or aggressiveness. Imagine Juan, a 35-year-old man. One day, he quit his job impulsively, convinced that he would start a $1 million business. He spent thousands of dollars and barely slept. His friends thought he was just ambitious, but weeks later, he couldn't get out of bed, overwhelmed with sadness. Sound familiar? This could be a sign of bipolar disorder. In depressive episodes, men may feel hopeless or helpless, lose interest in activities they once enjoyed, experience changes in appetite or weight, have trouble sleeping or sleeping too much, feel fatigued or lack energy, have difficulty concentrating, or think about death or suicide. Unlike women, men tend to report fewer changes in appetite and more externalizing behaviors, such as irritability or aggressiveness. A study published in the Journal of Affective Disorders found that 40% of men with bipolar disorder have a substance use disorder in their lifetime, compared to 25% of women. This underscores the importance of evaluating substance use when diagnosing bipolar disorder in men. Do you know someone who goes from being euphoric to irritable for no apparent reason? This could be a sign. Now let's look at how bipolar disorder differs between men and women. Although the prevalence is similar, there are key differences in the presentation and course of the disease. According to a recent study in the International Journal of Bipolar Disorders, women account for between 55.1% and 66% of bipolar diagnoses in large-scale studies, suggesting that they may be diagnosed more frequently. However, men tend to have an earlier onset, often in adolescence or early adulthood, and more intense manic episodes, often associated with legal problems or substance abuse. Women, on the other hand, typically experience more depressive episodes, rapid cycles, and mixed episodes, where symptoms of mania and depression occur simultaneously. Men are more likely to display externalizing behaviors, such as aggression or substance abuse, which can lead to misdiagnosis, as these behaviors are sometimes attributed to behavioral problems rather than bipolar disorder. Why is this important? Because understanding these differences can help identify bipolar disorder in men before it causes serious problems. In addition, men with bipolar disorder have a higher risk of suicide. One study suggests that the risk of suicide in men with bipolar disorder may be up to 8% higher than in women. This highlights the urgency of recognizing the signs and seeking help. Bipolar disorder not only affects mental health, but also men's daily lives. According to a study in PMC, people with bipolar disorder have lower employment rates and greater dependence on public assistance. Men with bipolar disorder face higher rates of absenteeism and unemployment. During manic episodes, they may make impulsive decisions that lead to financial or legal problems. In depressive episodes, fatigue and lack of concentration make daily tasks difficult, affecting work performance and personal relationships. How do you think these ups and downs would affect your daily life? Social stigma can cause men to avoid seeking help, exacerbating symptoms. According to Talkspace, men often deny problems due to gender norms that value emotional independence. This can delay diagnosis and increase risks such as suicide. Recognizing the signs is crucial. Without treatment, bipolar disorder can lead to job loss, broken relationships, or even suicide. But with early diagnosis and proper treatment, including medications such as mood stabilizers, antipsychotics, or antidepressants, along with cognitive behavioral therapy, many men can manage their symptoms and lead fulfilling lives. Imagine taking back control of your life. Isn't it worth a try? In addition, men with bipolar disorder may benefit from new treatments that are being investigated. For example, repetitive transcranial magnetic stimulation, RTMS, and intranasal ketamine show promise for relieving symptoms, according to an article in psychiatrist.com. These advances offer hope for those who do not respond to traditional treatments. If you're a man supporting another man with bipolar disorder, it's important to be understanding and patient. Mental health issues can be hard to discuss, especially for men who might feel embarrassed or weak about having them. Encourage open communication and remind them that seeking help is a brave step. Additionally, educating yourself about the condition can help you better understand what's going on. Resources like NAMI offer support and education. Share this video to raise awareness among others. Have you supported someone with mental health issues? Share your experience in the comments. Now, let's demystify some misconceptions about bipolar disorder. First, it's not just mood swings, it is a serious condition that affects daily functioning. Second, people with bipolar disorder are not always violent. Most are not, especially with treatment. Third, it does not only affect women, it impacts men and women almost equally, although with differences in symptoms. Fourth, it is not true that you cannot have a successful career with bipolarity. Many succeed with the right treatment. If you recognize these signs in yourself or someone close to you, don't ignore them. Contact a mental health professional. In the US, you can call 988 in case of a crisis. You don't have to face this alone. And if you found this video useful, please like, leave a comment, and subscribe to Real Men, Real Minds. Also, share your thoughts in the comments below. Have you seen these signs in anyone? Let's start a conversation. Thanks for watching, and remember, it's okay not to be okay. Take care of yourself and others.